Can you see my screen?
Yeah, we can able to see your screen. Can you please make this presentation as slide view so that attendee can get the clear view on your presentation?
Okay, I am going to present a result of the assessment of psychological distress among family caregivers of mentally ill patients in 2 selected hospitals in Southeast Nigeria. The presentation is going to follow this outline, which includes introduction, methodology, result and discussion, conclusion, and sample references. Caring for family relation with mental illness could be one of the psychologically distressing tasks family members tend to suffer for their sick loved ones. And these may include psychological stress, anxiety and depression, frustrations and sadness, coping with disturbing behaviors, loss of potentials, social embarrassment, and other potential losses. Caregivers indeed assume a primary role in the society with significant implications in economic, social, and biopsychological terms. Studies have also shown that these psychological problems are context-specific and can indeed be moderated by environmental and operational premises within which the healthcare facilities are located. Methodology. The study was carried out at the Federal Teaching Hospital, Abakaliki, and Federal Neuropsychiatric Hospital in Enugu State, Nigeria. It was a cross-sectional descriptive survey method, a cross-sectional descriptive survey. And the study sample consisted of 96 caregivers, and a Texila instrument was used to measure the psychological distress, while a standard questionnaire was used for the social demographic information on the social demographics. The Texila Psychological Distress Scale is a 10-item questionnaire, and it consists of, or rather, it's a scale used to measure psychological distress and has items that measure anxiety and depressive symptoms. Oh, sorry. The results. So with the application of the Texila 10-item scale, the results were generated. And from the results, age, gender, occupation, educational status were all analyzed. But it's kind of interesting to note that the results showed that the prevalence of psychological distress among the population was 58.3%, where 4.2, 29.2, and 25 had low, moderate, and severe psychological distress. However, when it was reanalyzed to show the groups that had more psychological distress, it was found out that female had more psychological distress than male. It was also shown that people that were unmarried or divorced had, people that were married had more psychological distress than unmarried or divorced or widowed. It was also showed that age groups below 25 years and between 34 years and 39 had lower psychological distress. However, when it was subjected to test of significance, it was found out that gender was not significant, diagnosis and every other factor were not significant. It was only the age as well as the age and marital status that were significant. So the study concluded that gender is not significant when considering the caregiver to be selected. Age of caregiver was very significant. Marital status was also significant when considering family member to be selected for caregiving for a patient with psychological disturbances. Based on the finding, we could recommend that for us to reduce the burden of the prevalence of mental disorders among family members family members, we should advise that those that are unmarried and those below the age of 25 and above 40 years to be selected so as to reduce the prevalence of psychological distress. Thank you. Hello.
Hello. Thank you, Ms. Chinwe, for the wonderful presentation. Attendees, we have enabled the poll session for Ms. Chinwe's presentation. You can participate in polling. Also, if you have any questions related to Ms. Chinwe's presentation, you can post your questions in chat box or Q&A session. Chinwe could have answer for that.
Any questions?
Ms. Chinwe, we may wait for a few minutes. Can give time to attendees to type their questions in text box.
I can't see questions here.
Okay, we have one question. In which gender in psychological distress more common in family members taking care of a mental disorder patient?
We said that gender was not significant, even though, sorry, it was more in male than in female. Sorry, it was more in females than in male. So the distress was more in females than in males.
Okay, so we have another question. Please, does the kind of person that the caregiver is attending to a correlate of kind of stress they suffer?
I didn't understand your question, sorry.
Does the kind of person that the caregiver is attending to correlate of kind of stress they suffer?
Yes, but it wasn't actually significant. However, those with more distressing, those that have more distressing symptoms tend to, those caring for them tend to have more psychological distress. However, it wasn't significant. For instance, those with schizophrenia, those with psychosis, persons taking care of them had more psychological distress. though it wasn't significant.
Thank you, Ms. Chinwe. Attendees, do you have any more questions? Yeah, we have one more question. What were some of the recommendations of this study?
Well, it's recommended, for at least for studies, more studies to be carried out, in other institutions across the country to see if the same result will be gotten, so as to inform our practices, both in the hospital and even in directing the general public on how to select those that care for family members with such diagnosis. So
great.
It is also recommended.
Yeah, we have one more question. If gender is not significant and yet more women are seen as caregivers, what do you recommend in male involvement?
I didn't understand you, sorry.
If gender is not significant and yet more women are seen as caregivers, what do you recommend in male involvement?
Yeah, it's male involvement in care is being encouraged. So we recommend that health workers at every level of engagement with the public should emphasize the support and involvement of males in caregiving.
We have the next question, Ms. Chinwe. Most caregivers are females and have multiple tasks. Caring for the mental relatives means additional stress.
Yes, if we look at the role of women, that could actually explain the way the distress skewed towards their side, because women tend to have more roles in their own immediate family. They tend to have more roles to play, such, being pregnant or maybe carrying babies, nurturing younger ones, and even caring for the males. That may also explain why unmarried people tend to have lower distress than the married ones.
Thank you. We have a next question. In course of your research, did you find out the reasons for the variation in distress level among the gender?
That could be subject for further studies exploring the reasons for such variability.
Thank you, Mr. Chinwe. It was a great presentation.
Thank you.